Hello, Miss Acton. What brings you into the clinic today?
Oh, doctor, it's the pain in my feet again. It's just not getting any better.
Oh, boy.
The McMaster Pain Assistant is a suite of tools designed specifically for primary care clinicians using the OSCAR open source electronic medical record, giving OSCAR EMR the ability to think about pain and teach the clinician and the patient about evidence-based practice in the moment of clinical care. The overall aim of the McMaster Pain Assistant, or MPA, is to promote and support a holistic, biopsychosocial approach to pain management and to improve the experience of pain care for both the clinician and the patient. It does this in the following ways. The MPA provides one workspace where all of the patient information relevant to pain care is at your fingertips. Encounter guides suggest evidence-based management. They offer resources for providers and patients and can become your progress notes and referral letters. Parameters that are assessed for other chronic diseases are automatically drawn into the MPA tools. All numeric measurements are displayed in a tracker list, as well as graphically. Let's take a look at how this works. What you see on the screen is how the OSCAR EMR appears in the 2014 version of the user interface. Ms. Acton's appointment is seen on the left of the screen. Clicking on her name opens her chart in the summary view. Her progress notes are seen in the center scroll, along with all of the usual general medical information. At the bottom is our progress note editor, always in view no matter what tools we are using. Across this menu bar are various EMR functions we may wish to use for any patient. Let's click on the Health Tracker tab. Health Tracker is where all of the chronic disease trackers are collected into one place, along with tools specifically for each of those conditions. Across this bar, you first see your home landing tracker that you can customize for what you want to see first for every patient. In my case, I have specified only blood pressure to show up. The PHV button, or periodic health visit, will also show for every patient. Since diabetes has already been entered into Ms. Acton's disease registry, that tracker is also visible. Ms. Acton is here about her pain. Clicking the down arrow shows the menu of all available trackers at this time. We will choose the Pain Assistant. Since we have never entered a pain diagnosis in her disease registry, we are prompted to select from a short list of pain diagnoses. If we want to go ahead and use the Pain Assistant, but are not interested in pain becoming a disease registry entry, we can skip this step. But entering in the disease registry is highly recommended since it facilitates practice management for specific populations, as well as research and quality improvement. I will make a disease registry entry. In the menu bar, the blue color on the pain button indicates this is the tracker we are currently viewing. The list of measurements that appear in the tracker have been selected as a default group that you may wish to customize. We can see that Ms. Acton has had a number of measurements that have been populated in the past. These may have been entered manually by any clinician, automatically from one of the assessment tools designed for the MPA, or they may have been cross-populated from measurements entered from other chronic diseases.
Okay, Miss Acton. From the questionnaires we did together on your last medical visit, I can see here that your mood and sleep may be getting a little bit worse. And if we look at the graph of your scores, you can see that they're going down.
Each measurement can be seen in a graphic form, making it easy to see trends quickly. These could be printed to give to the patient, or to send with a referral or letter to an insurance company if appropriate. Let's look at how these measurements are generated. First, a score could be added in manually from a paper-based questionnaire. But the MPA offers several questionnaires that are scored and added into measurements automatically. On the right are the forms designed for MPA in the toolkit. Forms under Completed are saved forms from past assessments. Under Templates are fresh forms. You can see that there are tools for assessing many aspects of biopsychosocial health. Since we are concerned about Ms. Acton's declining sleep today, we may wish to repeat her PSQ-3 sleep questionnaire. We could leave her to do this on her own, ask her to do it on her home phone or tablet, and send it through the Personal Health Record portal, or we can complete it with her today. Once it is completed, as you see here, the score is generated, and when we save, the score is added to her pain tracker page under the sleep measurement.
Okay, Ms. Acton, I wonder if you could tell me where your pain is and describe how it feels for you.
Well, it's in both my feet. It's terrible pain. The soles of my feet are really sore and tender and hot.
Encounter guides have so far been developed for 2 different types of pain. They offer specific evidence-based decision supports for low back pain and neuropathic pain. Ms. Acton's complaint makes us suspicious of a neuropathic mechanism. We can open the Neuropathic Pain Encounter Guide. The guide has several key functions. It will walk us through appropriate assessment and management steps, gather the clinical information we wish to document as our progress note, provide the clinician and the patient with resources about evidence-based management, and help us to communicate some difficult messages to our patients through short, in-the-moment videos recorded by expert clinicians. Here we have suggestions about how to make a diagnosis, and further down, suggestions about how to treat neuropathic pain. Opening the sections we wish to use, completing only those sections, and ignoring others allows us to get through a visit efficiently. With each section, information to support our decisions may be accessed in a cascade fashion, allowing us to choose the depth we wish to explore during the encounter. In some cases, parameters that exist elsewhere in the chart, such as lab results for vitamin B12 and diabetes status from the diabetes tracker, are automatically pulled for easy reference in this encounter. We could play a 2-minute quick info video directed at the patient and clinician to help arrive at a shared understanding of appropriate management. And finally, we can print the completed encounter guide to give to the patient, send to a consultant, or include in an insurance letter if appropriate. We can also forward this directly to the patient's personal health record.
So Ms. Acton, it looks like you have what we call neuropathic pain. Mm-hmm. And as you recall from the video from Dr. Moulin, this is a unique type of pain that requires a unique type of treatment. I'm going to give you a record of today's visit, so you can access some of the websites that will offer more information about neuropathic pain. Does that sound okay?
That's very helpful. I feel like I finally understand why I wasn't getting better. The video helped me.
Great. As I mentioned, this unique type of pain requires a unique type of medication. So I'm going to give you a low dose of a prescription pain medication that we also hope is going to help with your mood and your sleep. And then we'll follow up in 2 weeks' time and see how you're doing. Does that sound okay?
That sounds great. I'm hopeful. I'm hopeful that we're going to try something new and really get rid of this pain.
Wonderful. We'll see you then.
Using the McMaster Pain Assistant in the Oscar EMR is a patient-centered approach to supporting the assessment and monitoring of the biopsychosocial clinical issues that occur with the pain experience. The McMaster Pain Assistant is integrated with other chronic disease management tools so that workflow in assessing and monitoring individuals with multiple chronic conditions is efficient and effective.